Hello, it's Red. For my critical issue, I chose violence in healthcare, more specifically violence in the emergency department. Although violent encounters occur across the entire healthcare spectrum, violence in the emergency department, along with mental health in geriatric facilities or departments, represent the highest amount of injury or assault on healthcare workers. This issue is very personal to me. I've been assaulted many times, of course, verbally and physically. Just a couple of weeks ago, I was struck by a patient in which my glasses were broken. I had some abrasions on my face. No lost time at work, but it was expensive. My glasses are about $600, and although I did get reimbursed by my facility, it's still it's still an issue. No one as a nurse goes to work expecting to get hit or be assaulted by a patient. We're there to help people. Yet every day, healthcare workers and nurses underreport because we have become accustomed to this is just part of the job. They're just acting out because they don't understand. This is a problem and it has got to be fixed. Recently, there's been a big push from staff at our facility to increase security in the department, and in order to do that, we had to justify it. So we've all had a heightened awareness of safety and security. Family or patients begin to yell at us. We now call security to not only show force, but to give that expectation of patient behaviors, which tends to be one reason that patients have identified as a reason for their outbursts. They don't know exactly how they're supposed to behave. So we often have that discussion. We also have done a lot to educate patients in our emergency department in the waiting room as to their wait times. We often have 3 and 4 hour wait times at our emergency department, and that's with a 70-bed emergency department, and we often have over 100 people in the department patient-wise. We also strictly control access and have tried to become more consistent on how many visitors patients can have and when. We also have practiced multiple times and instituted a lockdown scenario to where we escort visitors out of the department to help maintain some control of safety. We also have a dedicated area for violent patients that is five rooms. 4 of which are psych-safe rooms, but this part of the department itself can be locked down and only security has access. So even nurses, if we're going back there, have to have a security officer with us to access that department. The time for change in healthcare in regards to violence is now, with many institutions trying to go or apply for magnet status in the institution of shared governance. This is huge. This is our time to have a voice as nurses to promote our safety and not be afraid to go to work and to be assaulted.